National Nutrition Natural Health Reviews. 3 minutes of the latest naturopathic info with Canada's leading nutrition experts. Watch, learn, and get healthy naturally.
Hi there, Naturopathic Doctor Jonathan Beatty here, health expert at nationalnutrition.ca. There's a rare condition out there called hemochromatosis that can actually be quite severe for people who suffer from it. And if you do suffer from it, today I'm going to discuss a few of the things that you can do to help manage the disease and reduce any of the dangers that disease may pose to you. So there's two types of hemochromatosis. There's primary and secondary hemochromatosis. Hemochromatosis is essentially a toxic buildup of iron in your system, either due to hyperabsorption of iron or in some cases due to a blood disorder that causes massive releases of iron from the blood. So the primary version of hemochromatosis is the genetic version. In this version, people's bodies don't regulate their iron levels. The human body, the more iron you have, the less you'll absorb out of your diet. However, in people with hemochromatosis, this auto-regulation doesn't occur, and their body's always trying to maximally absorb iron, and so for this reason, they often end up with elevated levels of iron in their blood. In secondary hemochromatosis, the elevated iron levels often are a result of rapid cell turnover of the red blood cells. So conditions like sideroblastic anemia or thalassemias can sometimes cause this hemochromatosis because in changes of how the body manages hemoglobin, how it manufactures hemoglobin, and how it eliminates it, causes this elevation in iron in the body and in the blood. Why this is dangerous is although iron is a necessary nutrient, too much of it causes a problem because iron can be oxidized. Iron is a very potent chemical, and what it does is it actually can create oxidative damage, which causes inflammation, stress, and actually can cause the formation of diseases like cancer. So this is why we want to get hemochromatosis under control. You know, inadequate levels of iron are a problem. We call that anemia. Excessive amounts of iron are equally problematic, and that's this condition, hemochromatosis. The most common treatment for it is actually to give blood. The easiest way to get your iron levels back into normal is to go out and donate blood. Even if they can't use the blood because of the elevated toxic iron levels, what they can still use is the plasma, so they can separate the iron away. But the easiest way is actually, they call it to give blood or to be bled. So that's the major way in which we treat this condition. Other things you'll want to do though, because the iron is a pro-oxidant, you want to make sure you take in high levels of antioxidants because of course you're constantly going to be managing this elevated iron in this elevated oxidative stress situation. So I typically recommend to my patients that do suffer with hemochromatosis to take in something called L-glutathione or reduced glutathione, and the reason for that is glutathione is a very potent antioxidant that actually prevents the oxidative stress from iron. Other things you can do to boost your own production of glutathione is to take in something called N-acetylcysteine. This is what we call a precursor to glutathione, and so when you give your body adequate N-acetylcysteine, your body will produce more glutathione naturally. Additionally, you'll want to do things like drink lots of tea. I know this sounds like a weird one, but tea actually binds iron in the gut and prevents the absorption of iron. So if you do eat food that has higher amounts of iron, say things like red meat or liver, typically what you're going to do at the same time is drink a cup of tea to try and help reduce the amount of iron that's available to be absorbed. It's the exact opposite of what people want to do if they have anemia. So if you suffer from hemochromatosis, I hope this video has helped. Check out our channel if you like this video, subscribe, and if you have any questions or comments, please post them below. And always remember, knowledge is health.